Let's go see the patient. Hi, good morning. My name's Aida. I'll be taking care of you today. Can I have your name, please? And your date of birth. Great. Hi, Sydney. Nice to meet you. Thank you for verifying that. So we have a doctor's order to administer your insulin this morning. How are you feeling? Okay. Well, the doctor just wanted us to administer this injection to help bring your there's too much sugar in your blood right now. So the doctor wants to bring those levels back down into more of a normal range, okay? So I just wanted to make sure that you understood that. Do you have any questions for me? And also I wanted to ask you where you prefer the injection. In the abdomen? Okay, great. We could definitely do that. So one moment while I gather my supplies. So Lisa, as I'm speaking with the patient, because she is in a state of hyperglycemia, I also want to make sure I'm monitoring, when I assess her, I want to make sure she's not in signs of distress, that she's alert and oriented, and that I've checked her vitals to make sure she's not like in a bad place or in an unsafe place, so that I don't have to address other issues other than the injection at this time. So I'm going to go ahead and at this point in time too, it'd be perfect if I had a scanner, because if I had a scanner, it would bring the patient's chart up in the electronic system, and I would be able to verify everything. Just a recap of the 5 medication rights. I have the right patient with the right drug, the right dose, the right route and time and frequency. And right now I have everything set. I have 8 units, subcutaneous, and we're ready to go. So I'm going to go ahead and put my gloves on. And so for this injection, Lisa, we are going to be using an insulin syringe. And what's very nice about these syringes is that they have a yellow cap, and they're specifically for insulin injections. And so the first thing I'm going to do is I'm going to draw 8 units of air. Okay, I'm going to go ahead and recap this for a second. I'm going to take my regular insulin that I have verified with Pyxis, with the patient, the chart. I have verified everything. I have to clean the top of the diaphragm. Okay. Now I'm going to take my 8 units of air and I'm going to put it into the vial, and I'm going to press down. So now I'm going to take my vial and my syringe, and assuming that it's all together in one place, and I'm going to keep the needle in the liquid, in the medication that is. And I have drawn 8 units of insulin. I hope you could see that. At this point in time, I'm also going to have a nurse come in because we need to verify this with another nurse, and he or she's going to give me what they see, and if it's concurrent with what I have, I will proceed with the administration. So for a subcutaneous injection, and I'm just going to place this down, I'm going to recap it because I haven't used it, but it's ready to go. So for Sydney, because she is a thinner patient, I'm going to first cleanse the area. I could either come in at 45 degrees or 90 degrees, but because she's a thinner patient, I'm going to come in at 45 degrees. I'm going to pinch an inch of the abdominal subcutaneous fat at 45 degrees. That's approximately 45 degrees. I'm going to go in, press slowly, press out. Okay, then if needed, I would hold there for a second. I'm going to recap my needle, dispense of it in the sharps container. I'm going to take my gloves off, throw them away. I'm going to wash my hands. And before I leave the room, not only do I want to make sure that the patient is in a comfortable position, that she is fine, not experiencing any adverse reactions, but I also want to make sure that I document the date and time, the name of the medication, the regular insulin, the 8 units, that it was a subcutaneous injection, and that it was administered in the abdomen. Thank you.